Hi, it's Congresswoman Jan Schakowsky. I'm back with my plans and pans. Well, on Friday, the House of Representatives supposedly adjourned for what we call the August recess, although there's plenty left undone, and maybe we'll be continuing to pass some bills in the meantime. But what I wanted to tell you that great success as we left Washington, D.C. on Friday, the assault weapons ban bill passed the House of Representatives. What a tremendous achievement. An achievement, I like to say, is very much due to the incredible advocates, even to the very last minute. We're talking to members of Congress and counting votes. And yes, those votes were there in the House of Representatives to ban assault weapons. And after 2004, a ban that we had previously expired. And we have seen these mass shootings, including, as you well know, pretty much in our own community. Highland Park is so close to the 9th Congressional District, and many of you know people who are still suffering the trauma and hopefully not the injury or death from that terrible, terrible shooting. The AR-15 is the weapon of choice these days of mass shooters. The shooter in Highland Park was able to get off 83 bullets in just a matter of maybe a minute, a few seconds. It's just remarkable. Why are these weapons of war on the street? That is what the majority of members of the House of Representatives asked, and the answer is they shouldn't be. And so, this legislation passed. We're grateful to all the people, including victims who have fought for many years, to make that happen. Of course, now we want to go to the Senate. But make no mistake, even passing the House of Representatives, which hasn't happened for, since 2004, this is a huge victory. Wanted to also talk to you about very important legislation we passed on the CHIPS and Science Act. You know that the chips, what we're really talking about are semiconductors, things that are used in pretty much everything that has a computer. But the lack of the United States manufacturing our own chips, our own semiconductors, has been one of the forces that has really hurt our supply chain. You've heard about the shortages of so many things, anything that uses a computer, but cars have been affected. Your telephones have been affected, and this legislation will not only make sure that we make them in America, that we increase our manufacturing capacity, which had gone down over the years. Let's face it, why? Many of the manufacturing got sent to countries that had lower wages. Manufacturers, closed their shops and sent them other places. Time we brought them back, and we have really been suffering from that. But this legislation also creates institutes, 10 new research institutes. Note that the name is Chips and Science, because we're going to concentrate more not only on the production, but also on research to make sure that the United States is at the head of the line and not so far behind as we have become. So we are excited about that legislation, which passed the House, the Senate, and in a bipartisan way, and we expect it will be signed by the president. In the meantime, Nancy Pelosi did have a ceremony marking the passage of the bill in the House of Representatives that I was proud to attend to. Of course, we've been focusing on abortion, but I wanted to focus on a slightly different angle, and that is international abortion rights. You know, the United States of America is one of the biggest contributors to healthcare around the world, something that we should be proud of, with a major exception. In 1973, the same year that Roe v. Wade became the Supreme Court made the decision making it legal, abortion legal, Jesse Helms, who was in the United States Senate, a very, very conservative Republican senator, got passed something called the Helms Amendment that said that no foreign assistance could go to countries, even those where abortion is legal, to support abortions. And this has been a real tragedy for many women around the world who want to be able to get an abortion. Now, the Helms Amendment had the exceptions for, at least in the language, rape, incest, or life of the mother. But unfortunately, this amendment has not been interpreted that way by many countries around the world. And so what we know is that many women have been deprived of the foreign assistance that could go to help save their lives. I've been in some of these countries where I see women waiting at clinics, often with their children, often several children in hand. We know that they would like to be able to stop bringing another child into poverty. But if those places, those clinics want to get money from the United States of America, it's very hard because of the Helms Amendment. And we know from the Guttmacher Institute, which is one of the outstanding institutions that looks at the issues of reproductive health, that 17,000 fewer maternal deaths would occur if the Helms Amendment were not in place. We're also trying to get the help of the administration to clarify the exceptions. So at least in the case of rape or incest or life of the mother, especially when rape has become a weapon of war, we should make the exception that the U.S. assistance will help those women who don't want to carry the child of their rapist. I have legislation that is called Abortion is Healthcare Everywhere that would repeal the Helms Amendment, and that would make it possible for public dollars in the way of foreign assistance could go to countries to be able to save the lives of many, many women. And I am really proud and delighted that just this week, Senator Cory Booker introduced a companion piece to the legislation that would repeal the Helms Amendment. And so we now have bicameral, that means House and Senate, support for getting rid of the Helms Amendment. Yes, we have our own battles here in the United States to fight when it comes to women's reproductive health. I wanted to point out to you, I don't know all the details yet. We'll have to get more information from you, but we have heard in the last just few days that major pharmacies have seen some of their pharmacists deny prescriptions that they say go against their religious beliefs, like filling a prescription for birth control. I'm not talking about medication abortion prescriptions. I'm talking about birth control. When they say they don't want to fill a prescription, the pharmacist is saying no. And we have to call on the pharmacies to change that policy, to make sure, well, if they say that, someone for their own religious belief doesn't have to give something, at the same moment, at that pharmacy, a prescription needs to be written and a customer needs to leave with that prescription in hand. I think this is a thing that is now spreading across the country. I'm sure that this is an organized effort to get pharmacists to deny certain medication. We already have heard of some intimidation at the counter in pharmacies. Imagine a young woman who really doesn't want to have broadcast to other people waiting at the pharmacy that she's there for birth control. I mean, that's one of the reasons that we had to, and we did, pass in the House of Representatives legislation that made sure that birth control, that all the different methods are legal. But think of that. This is now an issue around the country. It's just even hard to believe. This week, I met with my brothers and sisters from the Service Employees International Union. I am one of the very few actual monthly dues paying members, and I belong to Workers United, SEIU. You may have heard of the efforts of Workers United right now, helping employees at Starbucks become members of unions. But the meeting that we had was with workers who were talking about low wages. And so we were talking about some of those low wage jobs. But the good news, we are seeing a resounding growth now of efforts to unionize. We have seen a 58% increase in the number of applications for union recognition at the National Labor Relations Board. The same time, we've also seen about a 10% increase in employers trying to fight unionization. But what we are seeing is that the vast majority of Americans support the idea of union organizing, and we are seeing efforts all over the country to make that happen. And certainly in the Congress, we need to do a much better job to raise the minimum wage. I was at a press conference this week with some of my colleagues to introduce what is called the President's Billionaire Minimum Income Tax legislation. I was especially proud to say a few words about that because my twin grandchildren, 9 years old, Alice and Aiden, were visiting Washington, and I was really excited that they got to see me make a little speech. And of course, the speech started out by saying, well, this is the richest country in the world at the richest time in history. Now, if you ask millions and millions, actually most Americans, if they feel that sense, that this is the richest country in the world, they would tell you, many would tell you about the struggles that they're having to make ends meet, to make sure that they're able to put food on the table, to pay their rent, all the anxieties of having not enough money, low-wage jobs, as I was talking about before. And so what we're seeing actually is the continuing escalation of income inequality in the United States of America, where actually low-income people in particular are losing ground. Many Americans are feeling stagnation. But we are seeing huge profits, record profits, and record income to the wealthiest Americans. So this legislation would require households worth over $100 million to pay a tax rate of at least 20% on their income each year, including realized and unrealized gains. What this would do would really begin to level the playing field, but also what it would generate would be hundreds of billions of dollars that really could be used for so many of the basic needs in our country, to help families and communities and our agencies and, all the things that we need to have a just country in the United States of America. We don't want to see this slide and disappearance of the middle class. We want people who aspire to be in the middle class to be able to get there, and we want to make sure that our tax policy is fair. It is time. It is past time that millionaires and billionaires pay what they owe. And with the full support of President Joe Biden and a growing number of members of Congress, I am hoping that will become the law of the land. Well, Saturday, July 30th, marks the 57th anniversary of Medicare and Medicaid. And do you know that before Medicare was enacted, 56% of American seniors had absolutely no health insurance whatsoever. And some 76 million Americans are now covered by Medicaid, which not only provides health insurance for low-income people, but also pays about 60% of the cost of long-term care. I mean, these are the most precious programs that we have. And one of the things that we have to make sure is that nobody considers cutting Medicare or Medicaid. This is not an idle warning. We have heard that from some members of the House and the Senate, that these are programs that are paying too much money. Can you imagine? We want to expand these programs so that they cover eyes and hearing and dental work. That's the direction that we need to go to. About 64 million Americans, mostly people over 65 years old, are on Medicare. It also, though, includes people with disabilities. And so this is such an important program. This is really hands off my Medicare and Medicaid, and let's even do better to provide for health care for, you know that I'm for Medicare for all, which would be the best thing, and probably the most, I know, the most cost-effective way if everybody was covered like most other industrialized countries have. But in the meantime, we have these precious programs that are worth fighting for. So happy birthday, Medicare and Medicaid. I also just wanted to give you an alert, something to watch for. We are going to see over the next, week, 2 weeks maybe, the Inflation Reduction Act of 2022. Some of you who have been following the news about Joe Manchin and the reconciliation bill that months ago we called the Build Back Better bill, that we wanted to, with a simple majority vote in the Senate of the United States, devote a lot of resources to our health care, to all kinds of benefits for our families, and including addressing the climate crisis. Well, that is not off the table, it turns out, and you're going to see the Inflation Reduction Act of 2022. I'm still, fingers crossed, things happen, but we really think this is going to happen. In the legislation, you're going to see policies that will lower the cost of prescription drugs by having a negotiation to lower those drug prices with the pharmaceutical companies. Isn't that about time? We will also see that some of the reductions that were made in the Affordable Care Act are going to remain permanent. We aren't going to see any increases. That's a really good thing, because that could have happened if we don't pass this Inflation Reduction Act. And finally, there's going to be over $300 billion to address the climate crisis, which also has the effect of creating good, clean jobs here at home, as well as reduce carbon emissions. This is something that Joe Manchin now has agreed to in the Senate. And you may be wondering, well, how are we going to pay for all of this? Aha, that's some of the best part of the legislation. There will also be, in this legislation, an increase on the wealthiest corporations in this country, as well as the wealthiest individuals. But let me also make clear that no one that makes less than $400,000 is going to have to pay, as the president likes to say, a penny more. So this is really, really important legislation that we should be seeing coming in the next few weeks. Well, let me tell you at the end about COVID. You remember, I think it was last week, I said it was the president and the governor of Illinois that had COVID, and now we see, unfortunately, that Senator Dick Durbin has COVID. And you're probably hearing from friends of yours that they are experiencing these new variants. And so I just want to tell you that in the past week, there were 35,371 new confirmed COVID cases and 48 deaths last week. And Cook County continues as a high COVID zone. Be careful, stay safe, and I hope to be back with you soon with very good news. Thanks so much. I'll see you soon. Thank you for watching my video. Make sure you subscribe to my YouTube channel and follow me on Instagram, Twitter, and Facebook, where my handle is @Jan Schakowsky.